Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. There is a scenario that I absolutely detest hearing about whenever I hear doctors doing this. And I've been in situations over the years where I've heard about colleagues behaving in this way, thankfully not very many because I've worked in the better places, and I've heard experiences recalled to me by patients, people contact me, and I have been on the receiving end of this many times as a family member who is dealing with healthcare interactions with relatives. And the situation is this: when doctors don't think it's their job to speak to family members. A typical scenario might be in a hospital. A doctor will get a call from a nurse, or maybe in clinic, a doctor will get a request to speak to a loved one about what is going on. And there is a not insignificant number of doctors out there who just roll their eyes. Oh my goodness, what does that relative want? That's not part of my job. Well, I've got news for you, doctor. It is absolutely part of your job because communication is often more important than technicalities. If you speak to patients or family members, they will remember communication more than technicalities. And how on earth could you not think that it is a core part of your job to speak to a loved one when they make that request? I've encountered this situation many times myself on a personal level, and I will say this: it happens in many countries, in the United States, United Kingdom, but I've encountered this situation more in the UK, and I don't know whether this is a reflection of the healthcare system, it being a socialized system, and maybe doctors kind of having a bit of a different attitude. But to be honest, a lot of doctors, when I've been in situations where it's clear that the doctor doesn't want to talk to me and they've known that I'm a doctor, I'm sitting there, or a request has been made to have me on speakerphone during a consultation, I think the attitude of a lot of doctors in the UK is that they're doing people a big favor because they happen to think it's a free service. It's not a free service. It is paid for by taxpayers, and it is a job of a doctor in any country, whether we're talking about the UK or USA, to speak to relatives, because often relatives will be more concerned about what's going on than the patient themselves. I see that happen all the time. And doctors may easily forget, in the hustle and bustle of the healthcare system, that people are at a uniquely low point in their lives, and it is an honor and a privilege to be a doctor. Your words and your presence carries a lot of power, and with your words, you have the power, even for a couple of minutes, to explain what's going on to people who have no clue, who are worried at their wits' end because the person they love most in the world, the center of their world, is in a tough situation. They're in a horrible spot, a low point in their lives. Maybe it's even a life or death situation. How can you not think that spending a couple of minutes, hopefully providing words of reassurance, speaking, communicating with compassion and empathy, won't make all the difference? And on a human level, I say this to any doctor. Imagine the person that you love most in the world, very sick, how much you would appreciate a doctor taking a couple of minutes to speak to you about what's going on, to provide you, hopefully, with some reassurance. And this is especially important when a patient may be elderly or incapacitated in some other way. I would like any doctor who receives that call, the family member really wants to speak to you, to not roll their eyes, to not think it's not part of your job. You should absolutely be running to do this. You should think to yourself, I'm a doctor. I'm in a position of real power and privilege here. I'm doing a good job. I'm doing good work. And a loved one is really worried. And I imagine myself in that position. And I am going to go and sit down for a couple of minutes and look people in the eye and explain what is going on with compassion. I'm going to answer their questions. That is a core part of my job as a doctor. So I wanted to go on that rant because it really does bother me at a human level that any doctor could roll their eyes when a family member wants to speak to them about what's going on. I've seen this situation happen too many times, and when I've been on the receiving end of this, I've always thought to myself in my mind, to the doctor, stop being such a dick, pardon my French, or whatever the female equivalent is of that word. Doctor, this is a core part of your job, and if you don't feel it is, you shouldn't be practicing medicine, and this applies to any frontline clinical professional. Thanks everyone for watching. Feel free to comment down below, share your stories. Dr. Suneel Dhand. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again very soon.